I'm Mike Davis. I'm a student therapy assistant with South University, Montgomery, Alabama. This is my patient, a friend of mine, Robin. Robin, do you give me permission to do range of motion and some manual muscle tests on you tonight?
Yes.
What we're going to do is we're going to start out with internal rotation, also referred to as medial rotation. It can be done in two different ways. You can have her prone and measure that way, or we have her short sitting, her hips at 90 degrees, her knees at 90 degrees. The normal range of motion for hip internal rotation or hip medial rotation is 45 degrees. Robin's athletic, we shouldn't have any issues, but I don't think she has any capsular issues or anything like that, but we're going to pass the remover through the range of motion. What I'm going to do at this point in time, I want to palpate her iliac crest, and when I move her into full range of motion, it's either going to stop due to muscular and ligament restriction, or I'm going to feel her pelvis either laterally flex or tilt. So basically we'll take her and we'll just move her through, and that's going to be her in range of motion. You'll stabilize the femur when you do this motion. When you feel, like I said, she actually has her, before her motion stops, before her pelvis tilts. The axis of my goniometer is going to be on her patella. The stationary arm is going to be perpendicular to the floor, and the moving arm is going to be midline. I wish this camera I'm having to record myself. The moving arm is going to midline of the anterior tibia in between the malleola. So what we'll do is we'll have her move through available range of motion. Go ahead. All right. We will line the stationary arm perpendicular to the floor. The axis of the goniometer will go over the patella. The moving arm is midline of the tibia in between the two malleola. And we will get a reading, overstretch. We have a reading of 30 degrees, and that is how you measure range of motion for internal or medial rotation. We will now measure her external rotation. Once again, she's short sitting, hips flexed at 90 degrees, knee flexed at 90 degrees. She's in a neutral abduction position. We have a towel roll up under her distal femur. It's kind of hard in this environment. Anyway, we have a towel roll under her distal femur to keep this femur parallel. And like I said, we will be testing for external rotation. The normal range of motion in external rotation is 45 degrees. Basically the same thing as internal rotation. We'll stabilize the distal femur. I will guard her left leg, just basically keep it out of the way, because the test is going to have her move her ankle in. So we're going to give her plenty of room to do so. I'm going to move her through her passive range of motion. I feel resistance, or I can palpate back here and feel any lateral tilt, lateral flexion or tilt of her pelvis. This is going to be the end of her available range of motion. The goniometer is going to be, the axis of the goniometer is going to be over mid patella. The stationary arm is going to be perpendicular to the ground. The moving or distal arm is going to be midline of the tibia, in between the lateral and medial malleola. So I'm going to go ahead and get set up for this test. We'll move her through her available range of motion. Up. Stabilizing the distal femur. Make sure it does not rise. Stationary arm perpendicular to the floor. Moving arm midline of the tibia between the malleola. Axis on the patella. And she is at 35 degrees. And that's how you measure for external rotation of the hip. All right, we're gonna move into hip flexion. Patients, the normal hip flexion is 120 degrees. Patient supine, 0 degrees of abduction, adduction, flexion or extension. Basically, she's just in a neutral position. So I'm gonna be measuring with the large goniometer as well. I will move her through passive range of motion. I will stabilize the pelvis and I'll palpate the pelvis because if I feel any posterior tilt or any movement in her pelvis, or when I feel resistance, I'll know that's her in available range of motion. So I'm going to passively move her through this time. Alright, I felt her pelvis tilt just a little bit, so she will be through that's her available range of motion. My landmarks for this measurement are going to be the greater trochanter, that's where the axis is going to be. The stationary arm is going to be midline to the pelvis or trunk, and the movement arm is going to be midline to the femur in line with the lateral epicondyle. So I'll get her back into full flexion. I'll palpate my thumb, her stationary arm is going to be great trochanter, axis over the great trochanter. Stationary arm going to parallel with the pelvis into the trunk. The movement arm is going to be aligned with the femur to the lateral epicondyle, which I can palpate with my fingers as well. And she is a 100 degrees of flexion. And that's how you measure for hip flexion. Hip flexion, just a small caveat that I left out a while ago. Hip flexion, the capsular pattern is going to be soft because of muscle bulk. Could also possibly be firm due to posterior capsule. Right now, she don't have any issues like that. Her infield was soft due to a muscle bulk. Like I said, she's an athlete, so she's pretty good. We will now measure her for hip extension. Normal range of motion for hip extension is 30 degrees. We have her prone, 0 degrees of abduction, adduction, basically in a neutral position. First, we need to passively move her through the range of motion. The infield is going to be firm due to anterior capsularity. So for this measurement, her landmark is going to be the same thing, the greater trochanter, And we can just internally, externally, I just want to double make sure I find out it's right there. The stationary arm is going to be parallel to the surface of the table or midline of her pelvis and trunk. The moving arm is going to, the axis is going to be on the greater trochanter, and then the moving arm is going to be midline of the femur down to her lateral epicondyle, which I can also feel on her. You can see what we'll do is we'll have her move, passively move into full extension. We'll have her hold it there. Great trochanter, axis parallel midline to the trunk, and then it's going to be align the femur to the lateral epicondyle. And she is at 15 degrees of extension. You may relax. You may relax a bit. It's been a long night for me too. Anyway, going back through hip extension. When the person goes through passive range of motion with hip extension, you have to stabilize the pelvis so you don't have any rotation or anterior tilt. And once you stabilize it and you feel her go through her passive range of motion, if you see any rotation or any tilt of the pelvis, that's going to be her end of her available range of motion. You may lift your leg down. And that's how you determine the availability of range of motion. We will now test, slide on up. Just go ahead and relax. We'll now test knee flexion. Normal knee flexion is 135 degrees. For this test, the patient's going to be lying supine in a neutral position. We will stabilize the I'm jumping ahead of myself. The infield of this test is going to be soft due to muscle bulk of her hamstrings and of course her calves. We will flex the knee to the end range of motion or passive range of motion. Her hip's going to flex some. We'll know when we have a resistance or her hip flex is greater than 90 degrees. Or pelvis flex is greater than 90 degrees. So we're basically just going to take her, if you can still see me, we'll feel kind of overpressure. And that's going to be her available range of motion for her knee flexion. For knee flexion, we're going to use our large goniometer again. The axis is going to be on the lateral epicondyle. The stationary arm is going to midline of the femur to the great trochanter, and the moving arm is going to be midline of the fibula to the lateral malleolus here. So I'm going to push her through her available range of motion. You'll see her pelvis tilt just some. It ain't going to be over any greater when it is loud. Feel for her lateral malleolus. Stationary arm is going to be midline with her great trochanter. Down the femur to her great trochanter. Moving arm is going to be midline of the fibula in line with the lateral malleolus. And she is at 125 degrees of knee flexion. Alright, we're going to now measure her for knee extension. Her left knee, patient's going to be, the position is going to be in supine. There's going to be a bolster up under her distal tibia. We don't have a lot of room. I don't have a bolster, so we used a mixing bowl. Good enough. Basically, I'm going to stabilize her ipsilateral femur to make sure she don't have any rotation, which she does not. Infield should be firm. Her infield should be firm due to ligaments and joint capsule. Some people may have some hyperextension. She does not, so we don't have to worry about that. But you can measure hyperextension as well if they have any excessive hyperextension. Same with knee flexion. We will measure the axis of my goniometer is going to be on her lateral epicondyle of her femur. The stationary arm is going to be midline of her femur, in line with her great trochanter. The moving arm is going to be midline of the fibula, in line with the lateral malleolus of her left leg. So, stationary arm, lateral epicondyle of her femur, and she is at 0 degrees exactly. And that's how you measure someone for knee extension. Now we're going to move into manual muscle test. We're going to start out with the manual muscle test for hip internal rotation. This is going to be for grades 3, 4, and 5. Patient's going to be sitting supine. In a neutral position. What I'm going to do is I'm going to palpate for knee adductors, tension fascia lata. I can feel it contracting. Move down just a little bit laterally. The gluteus medius also assists in this motion. I can feel that contracting as well. What I'll do is I'm going to stabilize the femur, have her move into this position. I want you to hold against my force. My hand will be placed just proximal to the ankle, and the pressure is going to be down and back towards midline. Press, press, press. She holds against maximal resistance, so she will be graded a 5 out of 5. I should have did this a while ago. Same thing. Internal rotation. This is going to be for grade 2. Patient supine. What I'm going to do is I'm going to passively externally rotate the patient's hip. Once I've done so, I'm going to ask the patient to actively internally rotate the hip. Would you please internally rotate the hip? If she can complete this motion without any assistance, with gravity minimized, it's going to be a grade 2. This is going to be for external rotation, manual muscle test, grades 3, 4, and 5. What I'll do is patient sitting at the edge of the table in a neutral position, good posture. I will palpate the iliac crest, and I will move her through her available range of motion. Don't lift your leg. Let me have it back. You gotta relax. Back. Relax. Relax. I'm just moving you through the available range of motion. At this point in time, I'm going to move her through her available range of motion. I'm going to brace at the distal femur. My resistance is going to be pulling back towards myself. I'm going to show the patient, do not allow me to pull you and pull the muscle back. She did not break. She was able to hold against maximum resistance, so that would be a 5 out of 5. This is going to be a manual muscle test. This is going to be a manual muscle test for hip external rotation. Patient's going to be laying in supine. What I'm going to ask her to do is I'm going to ask her to just rotate her leg outwards. Piriforms are very deep, but I can feel, relax. I can feel muscle contraction. Like I said, once I get where I need to feel, I'm gonna have her actively rotate her leg outwards. We do so. I can feel contraction of the piriforms, and she was able to rotate her leg completely into external rotation. So she's going to be in a gravity minimized position. She's going to be a 2 out of 5 for external rotation manual muscle test. All right, I'll be now testing the patient for manual muscle test of knee flexion. It's going to be the hamstrings. You have to be careful when you're testing manual muscle test for hamstrings because you will create a cramp. Hamstrings will cramp up. So just be mindful of that. What I'll do is my patient's going to be prone. I'm going to palpate the proximal end of the hamstrings. I'll ask her to move her ankle towards her buttocks, which she can do so. I feel contraction of the hand. I felt contraction of the hamstrings.
I'm so sorry.
That's all right. Wait. Well, I was just talking about it just happened. She had a severe cramp in her hamstring. So we're going to rest that leg. This is for demonstration purposes, so we're going to go ahead and do the other leg. So basically, like I said, my patient's laying prone. We have to watch out for inducing cramps in the hamstrings, but I'll palpate her hamstring and I'll ask her to move her ankle towards her buttocks. Alright, she did so. I felt the contraction. You can go ahead and relax. Go ahead and relax. I felt the contraction through her hamstrings. So at this point in time, I'm going to position myself a little further up towards her torso. I have her move her knee into 90 degrees of flexion. 90 degrees of flexion. You're going to resist my force. You understand?
Yes, sir.
I'll take my hand by mid tibia and I'll press, and the force is going to be going back and pushing her knee back into extension. I'll stabilize her pelvis and then I'll push. She was able to hold against maximal resistance, so that's going to be a grade 5 out of 5. All right, we're going to be checking for manual muscle tests. Of knee flexion. Grades 2, 1, 0. We're just going to go through grade 2. Patient's going to be sidelined. Slide just a little bit closer. Just a little. All right. I'm going to support. Relax. Just relax your leg. I'm going to support her upper leg. I will make sure the patient starts in complete 0 degrees of flexion. I'll palpate her hamstring, and I'll have her flex her leg all the way back. Bring it to your blocks. She was able to do so. You may relax. A towel was placed on the surface, so it won't be dragged across the table. This is a gravity minimized test. She was able to complete that full range of motion by herself, so that's going to be a grade 2. This is going to be manual muscle test for knee extension, grades 3, 4, and 5. Patient sitting short sitting in a good posture. We're going to be testing the right leg. What I'll do is I'm going to palpate the muscle group that we're testing for is going to be the quadriceps. What I'll have her do is I'll have her go through a range of motion. Basically, she's just going to extend her leg. I can palpate and feel that her quads are firing. Go ahead and relax. Stabilize the hip. I'll have her do it again. Don't lean back when you do it. Keep yourself, go ahead and relax. At this point in time, I'm going to have her flex her leg. I'm going to keep it at about a 10 or 20 degree angle. My force is going to be, I'm going to apply force just proximal to the ankle. I'm going to have her knee flex at 10 to 20 degrees, keep the lockout mechanism from activating, and I'm going to tell her resist my force. I'm going to push down like I'm pushing the knee into a flexion. Alright, she's very strong quadriceps, so she was able to resist maximum resistance for manual muscle test of knee extension. Alright, we're going to test knee extension for grades 2, 1, and 0. This is a gravity minimized position, so I have her sideline. I've placed a towel up under her. We're going to be testing her left lower extremities, her left lower extremity. So I will support her right extremity in this position. I'll place a towel up under her leg. I will flex her leg. I'll palpate the quad, and I'll ask the patient to go ahead and extend her leg. Go ahead and extend it. All right. She was able to fully extend her leg. You go ahead and relax on the side. She was able to fully extend her leg in a gravity minimized position. So that's going to be a grade 2 out of 5 for knee extension. All right, Ms. Bridges, I'm so sorry I skipped over this. It's going to be for manual muscle tests of hip flexion and hip extension. The first one we're going to do is hip flexion, grades 3, 4, and 5. Patient's going to be short sitting on the side of the bar for this one right here. There's a few things that we have to make sure happens for this test to be reliable and accurate. First of all, we're going to be testing for the iliacus and psoas muscles. So when we do this test, I will actually encourage the patient to hold on to each side, because we don't want any pelvic tilt or any lean back of any of her trunk trying to assist in this muscle group in the hip extensors. So basically I'll come and I'll palpate her hip extensors. Alright. I'll have her hike her hip up. I can feel. Go ahead and do it. I'm going to start to do it actively. You may relax. I can feel those hip extensors fire. I'm going to place downward force just proximal of her knee, and I'm going to instruct her to raise her leg up, and I'm going to push down back towards her ankle. She's very strong, and so doing this, you actually lean back a little bit. Don't lean back for me, not so much resistance this time. Push, there you are. All right. She was able to maintain, she did not break with maximum resistance, so she's a grade 5 out of 5 for hip flexion. All right, we're going to be testing her hip flexors for manual muscle test for grades 2, 1, and 0. Patient's going to be sidelined. We're going to be testing her left side. So what I'll do is I'll support her right side, like so. And the command to the patient will be flex your hip and bring your leg up to your chest. Go ahead and do it. All right, you may relax. So I had placed a towel up under the patient's lower extremities to keep from dragging across the table, because this is a gravity minimized test. She was able to perform a full hip extension on gravity minimized, so she's going to be a grade 2 out of 5. All right, this is going to be manual muscle test for hip extensors. We're going to be testing her right side. Once again, she had a severe hamstring cramp a few minutes ago. So the muscles we're going to be testing is hamstrings and glutes. So what I'll do is I'll stabilize the pelvis, and I'll have her extend her hip through the available range of motion. All right, let me lay it down. I'll palpate the proximal insertion of the hip, the hamstrings. I have her go through the available range of motion again. I feel the contraction. You may relax. Go ahead. Don't catch a cramp again. I can feel her hamstrings contract. This is for a manual muscle test of grades 3, 4, and 5. What I'm going to do is I'm going to apply force directly above the distal femur, straight down back towards the table. Have to be careful because you don't want her to break or what have you, and you mess up a kneecap or injure a kneecap. So basically I'm going to have her extend her leg, extend her hip all the way up. I'm going to push down the distal portion of the femur. She was able to withstand maximum resistance from me, so she's a grade 5 out of 5 for hip extension. All right, we're going to be doing a manual muscle test for grades 2, 1, and 0 for hip extension. The test leg is going to be her right leg this time. What I'm going to do is I'm going to support her upper leg like so. I'm going to make sure her leg is in full extension. What I'm going to have her do is I'm going to have her extend her hip. Go ahead and extend your hip. Your test leg. There you go. All right. Come back and relax. This is a gravity minimized test. I had a towel on top of the surface, so her leg wouldn't be dragged across the test, so it's gravity minimized. She was able to complete hip extension in a gravity minimized test, so she's going to be a grade 2 out of 5.